a we thing.
It's a we thing.
Hello, this is Anna Huff Davis.
And my name is Naomi Cottoms, and we're your host for today.
Today we are going to bring to you training opportunities in the state of Arkansas. The thoughts, ideas, and concepts shared in this podcast are based on the lived experiences of the host and their guests. Validation is incumbent upon the listeners. Today, I want to first acknowledge that after almost 2 years, Arkansas has a certification program.
Yay!
We are so excited, and we have some community health workers who have achieved this goal and received certification. The first group of certified community health workers in the state of Arkansas included Gloria Boswell, Melissa Buford, Larry Butler, Naomi Cottoms, Thelma Dunbar, Rosalind Stone, Sheila Washington, and Sharon Young. Shortly after that group received their certification, there was another group that came forward and completed all the requirements. And that group included Rosalinda Madrano, Albina Reichland, Terry Takamura, and yours truly, Anna Huff Davis. And then we had 6 additional community health workers to complete certification. Crystal Bridger, Santrice Kearney, Sharon Martin, Carlene Massey, Robin Thrower, and Luzanna Tubb. We are so excited and so proud of these community health workers who have received certification in the state of Arkansas.
Hey!
So now that we are well on our way with certification, let me just share with you what that means for community health workers in the state of Arkansas. We have 2 certification pathways for community health workers in the state of Arkansas. One pathway is based on experience, and the other pathway is based on training and experience. Both pathways are voluntary. There is no requirement that CHWs in Arkansas become certified. There is also an approved training program certification for organizations that will offer CHW core competency training. And Ms. Cottoms will tell you more about that. But I want to share with you that we have one organization that has completed that training and received their approval for a training program, and that is Tri-County Rural Health Network. Yay!
Yay!
Let's share with you what it means when you receive certification through the experiential pathway. The experiential pathway is for community health workers that have 4 years of full-time experience serving as a community health worker. 4 years of full-time experience is equivalent to 8,240 hours of community health worker service. The hours can be collected over a time frame of 10 years, but at least half of these hours must have been gained over the past 5 years. Experience gain can be paid and or volunteer, and this pathway just closed as of October 1st, but will be reopening in the early winter part of the year. Then we have the training pathway. The training pathway, sometimes called the traditional track, is for community health workers that have completed an approved community health worker core competency training. And this pathway also requires that a community health worker has 2 years of experience in addition to completing the training program. This experience can also be paid or volunteer, and it can be gained before or after the community health worker has completed the approved training program. The certification track reopened in October when the experiential track closed. So as you can see, they alternate. So if you're eligible to apply, they will alternate. You can apply for both tracks during the same time. One track will be open, that track will close, then the other track will open, and the other track the previous track will close. I hope that makes sense to some of you, but what I do want to encourage you to do is to go to our website, ARCHWA.org, and all of that information is right there at your disposal. As far as the approved training program, it's for organizations that offer community health worker core competency training. They can become an approved training program. Approved programs will become the gold star. They will have the gold standard for community health worker training programs in the state. Community health workers that are looking to become certified through the training pathway will need to complete an approved training program to apply for their certification. The requirements to become an approved training program are as follows. The program must be based in Arkansas. All 11 core competencies must be discussed in the curriculum, and Ms. Cottoms is going to share that with you shortly. The program must include at least 80 hours of didactic training. An additional 40 hours of guided field practice must be included as part of the training. The organization should have previous experience conducting at least one training program for community health workers. The director of the training program must have previous experience running community health worker programs and or serving as a community health worker. And the trainers must have previous experience running community health worker programs with at least one having served as a community health worker. So I know that's a lot, but I want you to know that Ms. Cottoms is going to expound on this. And as I said before, once you listen to this podcast, if you have questions, please go to the website. All of this information is there, ARCHWA.org. Ms. Cottoms?
Well, yeah, we want you to know more about the training. We want you to know more about the core competencies that are provided in the training. And it is a requirement if you are going to use the traditional track, where you will utilize your training plus a couple of years of work experience, be it volunteer or employment experience. So before the C3 project came along, we all began training our community health workers because we had to. We had to make sure that people were ready and capable of carrying out the duties that were being assigned. And so we started training, we started developing curriculums that were germane to programs, projects, to what we believe were most important for successful work as community health workers. But a national survey was done, and it ended up with the development of something called the C3 project. It was ended up with a list of core competencies, attributes, and the most common roles for community health workers. And so, as Anna shared, those competencies are a requirement by ARCHWA for certification in the state of Arkansas. So our project, our program, the Delta Training Center, which is a part of Tri-County Rural Health Network, provides training in those 11 skills. We recognize that oftentimes community health workers already have those skills, and all they need is to either be enhanced and or to learn how to organize them in a way that helps them to be most effective when carrying out their duties. So we focus on communication, making sure that the community health worker is able to use language confidently, make sure that they can communicate using plain language and that they're clear when they're speaking, that they understand the importance of listening and how to listen actively, to listen with empathy. We focus a lot on cultural listening, making sure that you can relate to all people regardless of their educational attainment levels. We talk about interpersonal skills and building relationships, because it's oftentimes the relationships that help the community health workers to move forward and get things done. So again, culture comes into play, conflict management comes into play, being a team member comes into play, coaching and providing social support, self-management, interviewing. All of those things are a part of our training as it relates to interpersonal skill. Service coordination, one of the things we do is look at what community members have, what they need, and what they would like to have. And so being able to coordinate those things is very, very key as it relates to the work that we do. Capacity building. We don't want to be the kind of people who will help people and cause them to become dependent on us or a project that we've introduced them to. And so we want to help them to be self-sustaining, self-sufficient, help them to understand how to do those things for themselves. So we spend a lot of time working on making sure that community health workers understand their role as capacity builders. We have to learn to do some advocacy, both for the community health workers, with the community health workers, and even sometimes to the community health workers. We have to learn to utilize our ability to educate and facilitate, because sometimes we have to talk to groups, small groups, large groups, but we have to get the message out. And so we want to make sure that we have the ability to do that. We have to do a lot of assessments, either for individuals and or for groups, even sometimes for full communities. And so we have to learn and make sure that we understand, again, what's already there, what resources exist, what's needed, and what's desired. We do a lot of our work by outreach. We go where the community members are. So we have to enhance our skill for outreach. We want to act professional at all times, conduct ourselves in a professional manner. We want to know something about evaluation and research, and we want to make sure that we are able to share that with the community members, to know enough about it to motivate and encourage their participation. And we want to make sure that we are knowledgeable about our community and what's in our community, understanding the resources, the culture of the community, and how these communities move and function and what the values are. And so we take all 11 skills, make them an intricate part or the root part or the framework for the training that we provide, so that community health workers are gaining as much knowledge as they can to be effective in the work that they're going to do. So the training is good. Ms. Davis talked about how it can be as less as 120 hours, and I've known it to be as much as 160 hours. And so it depends on what training center they're in, but it's intense work. It can be all the way up to 53 hours of a week of work in a 3-hour session, in a 3-week session. And so it is intense, but it's well worth it. It's a lot of fun because it's interactive and people come out with some enhanced or developed skills. And so we feel real good about the training opportunities. But not do we just make sure that community health workers in Arkansas have opportunities for classes, for training in training programs, but professional development is key in a lot of ways. And so there are annual conferences that we participate in. There's the Arkansas Community Health Worker Association Conference, and then there's the National Association of Community Health Worker Conference that we all are a part of. Ms. Davis, you want to talk a little bit about the Arkansas Conference?
Yes, I'd be delighted to. We held our conference May 16th and 17th. We actually this year did something different. We hadn't had a conference for a number of years, and this year was very exciting. We had a hybrid model. Due to COVID, we had some in-person or face-to-face attendees, and then we had some that were virtual. And it was an exciting time for us. It was the first time that we had tried to do something like this, and it was an experience for all of us. We went in, since we were a member or members of the Chronic Disease Coordinating Council out of the Arkansas Department of Health, and I served as the chair of the Chronic Disease Coordinating Council. I had the opportunity to decide what the actual Chronic Disease Forum Conference was going to focus on. And of course, it would be community health workers. And so we coupled our resources and we put on a conference together, and we held the 2022 Chronic Disease Forum and Arkansas Community Health Worker Association Summit. And our theme was building health one community at a time. We convened at the Doubletree Hotel in downtown Little Rock, and we started that Monday morning with breakfast and registration. We had our welcome from the Chronic Disease Coordinating Council Chair, which was myself, and Dr. Bala Simon, who serves as the State Chronic Disease Coordinator. We also had a greeting from the Senior Vice Chancellor for Academic Affairs and Provost at UAMS, Dr. Stephanie Garner, and we were favored with a keynote address from none other than Denise Octavia Smith, our Executive Director of the National Association of Community Health Workers. This particular summit this year was very valuable to all of the attendees. We had 3 tracks. We had a track for community health workers that dealt specifically with skills and building their toolbox. We had a track for community health worker workforce development and for employers and leaders. And we had a track for social determinants of health. And so persons who were in attendance had the opportunity to select from one of the 3 tracks. They could move away from that track at whatever time they felt they needed to and go to another track. But we had topics covering such areas as setting boundaries and including self-care and stress management for community health workers. We talked about integrating community health workers in clinical teams. We talked about health when we look at the LGBTQ community. We also had a wonderful, wonderful event the evening of the first day. We had storytelling, or we had stories by community health workers, and we also had a reception that featured the Marshallese dancers from Northwest Arkansas. We closed the evening by having a mix and mingle and dinner. So that was our first day convening. And then the second day, we were favored with some research basics by Dr. Kate Stewart and her community engagement colleagues. And she offered that in 3 parts during the day. We were favored with a welcome and an overview for the day. And then we were privileged to hear from Dr. Pebbles Fagan with the Center for Health Research and Social Justice. Then we went back into our breakout sessions, which were also in those 3 tracks once again. And we had with us Carl Rush and Dr. Chriselle Nash, who spoke with us on community health workers and Medicaid and how we can possibly work towards Medicaid reimbursement. We also had someone to present to us on working with undocumented clients. We had some information on our certification in the state of Arkansas, Alzheimer's, tobacco cessation, breast care. We had so many wonderful opportunities that were presented to community health workers. They were provided with a mental health first aid presentation and a presentation from the Criminal Justice Institute where they received training in utilizing Narcan. We also had a presentation from Dr. Kenesha Bryant Moore on transformational living to promote resilience and healing. So as you can see, we covered a lot of territory. We also had some awards that were presented. We had a Pioneer Award that was presented to Dr. Catherine Stewart for the work that she has done with, for, and about community health workers. She has been a strong, strong ally. She works for the College of Public Health at the University of Arkansas for Medical Sciences, but she has dedicated so much of her time, talent, and resources to making sure that community health workers are equipped and have the resources that they need to advance. And that not only includes financial resources, but technical resources. And of course, we know
absolutely
she is an invaluable asset all her own. So we really appreciate her.
Absolutely.
And then we presented an award.
Absolutely. So then we have the National Association of Community Health Workers Association and the National Community Health Worker Association. Conference was held back in August of this year, and that conference will be held again this year. In 2023, around the end of July or early August as well. And it has breakout sessions, it has plenary sessions, and it is a wonderful opportunity for professional development as well. This year, 2022, they had Joyce Harrow, a Native American who came and shared. She is a national poet and laureate, and she came and shared information not just about her poetry, but she even shared stories from the Native American culture. She was phenomenal. And so community health workers have many, many opportunities for training, for growth and development, and Ms. Davis and I are really excited about it, and we look forward to all of you participating. Again, we invite you to join the State Association and the National Association. They both have minimal fees, and you can go to the website to learn more. Thank you for listening to us, and it is a we thing.
It's a we thing.